Good morning, everyone. We are going to wait just a few minutes until our 10 o'clock start time, but we thank you for joining us today. Okay, it is 10 o'clock, and so we are going to get started with our school transition, reopening, and redesign task force work. I welcome all of our task force members, some of whom are on video and some of whom are on by audio with us. Some will be jumping in and out between audio and video for those of you who are following. I also want to welcome anyone who is just joining to observe the process. I'm looking online and we've got 185 attendees online right now on a variable number, but we appreciate your interest in this work. We appreciate you joining us this morning. I want to start by thanking both our task force members as well as all of those who participated on our work groups for all of the hard work that they have been putting in on this project over the past month or so. They have truly exhibited a spirit of collaboration and cooperation as we begin to hone in on our vision for what school will look like in September and how we might reopen those learning institutions to the students in New Hampshire. I just so that I level set, the work of the START task force is to develop recommendations, and those recommendations are going to be presented to the governor, to the Department of Education, as well as to our school leaders across the state who even today are working hard on trying to figure out what September will look like for school and their communities. And so we are moving that work forward today, and again, appreciate everybody's engagement. If you could jump on to my next slide there, that would be great. So today has a couple of objectives. We are going to summarize the activity of the work groups that have been busy at work over the last month, discuss some of the themes that came out of some of those work groups. We talk about finalizing our START recommendations. I would also say we're going to start finalizing. We probably won't finish all of that work today, but we will move that forward considerably. I know that you all, the members of the task force, have a lot of information from your participation on those work groups, and we thank you again for the work that you've done. But this is really the work of bringing that together, so that we can coalesce that into some actionable and usable information for our school leaders and for the governor. Next slide. There are a couple of methods in terms of engagement by our task force members. You can share your thoughts verbally. Just unmute yourself, jump on camera, and let us hear from you. You can type something into the chat box, which we will be monitoring so that you can do that. Use that as your interaction. And then as well, you can, if you have any technical questions, Jessica is available via chat and can absolutely help you to stay on track as we move forward. So let's jump into the actual work that we are undertaking here. Go one more slide for me. I want to briefly just kind of reintroduce the task force members. We're not going to go around and have everybody say their name because I think all of you know each other having worked in work groups, and we did introduce them before. But for those of you who are joining us, from outside, if they want to see the folks who are on the task force, it includes a very broad constituency of folks. And really what we have to understand is that this is just a small subset of the folks who have contributed to this work. If you think of this as the tip of the spear, we had, in addition to the task force members, we had work groups that included close to 60 individuals from across our state and from across a whole bunch of different disciplines. And as well, we reached out to our community and we got direct feedback from the community about the work that we are doing. So this is really coalescing all of that information and bringing it back together. But I, again, want to just thank everyone who participated in this process, whether it's task force members or work group members or folks out in the community who have contributed to this work. Thank you for participating. So the different activities that have been taking place, and you can roll out all of the different pieces of this slide, as we had the work groups. To recap for everybody, we had 6 different work groups who were simultaneously working on different information. Those included instruction, student wellness, operations, technology, student voices, and associations, really looking across the whole system. Those work groups came up with some initial recommendations to bring back to this task force, which is the stage that we are in, as we continue to move that forward. And then as well, we had our stakeholder survey, which is really to get some information from our community, those who are participating in our school system, and understand what it is that they think about relative to school starting in September. The work has progressed along the timeline that we set out from the very beginning. Other than the one delay we had because of the overwhelming response we got from our survey, we have stuck with our calendar in terms of moving this work forward and trying to create usable information for our school leaders. I sometimes think that what will happen in this work is that we're going to merge, right? We've got a lot of school leaders at the local levels working on information in their communities. This is work that's looking more statewide across the system and how we might bring these bodies of work together to formulate actionable plans for September. This work will conclude at June 30th with the provision of high-level recommendations for the Governor Sununu, for the department, and for our school leaders. And then as needed, and we had already set this expectation, so hopefully our task force members don't think I have another ask of them, we may ask them to come back as the circumstances warrant. If circumstances on the ground change and we need to adapt or change some of those recommendations or provide additional input to our school leaders and our governor, we can do that work. What I'd like to do now is just review some of the feedback that we have coalesced through the survey, just to set the table really for some of the work for the work groups. This absolutely does not include all of the data that we pulled together, and full data reports will be publicly available in the coming weeks as we continue to work through this very large amount of information. But just to kind of recap, in our survey, we had over 41,000 parents reach out and provide information to us relative to reopening. We had close to 12,000 instructional staff, and we had school leaders and wellness providers across the state weighing in terms of the work that's going to be done here. And I can tell you that there's some tensions that we want to highlight right now for you. But the overall feeling is, let's get back to school. Let's find a way to make this work. The first area that I really wanted to focus on relative to tension was one of our questions about whether I'm likely to send my child to school in the fall. And what you can see here is the parents, the instructional staff, the district and school leaders, and the student wellness all weighing in on that. But I think a couple of takeaways from this is that the majority are anxious to get back to school. Even, among our parents, we are at 69% and then higher among our other categories. So parents are a little bit less so. But then we also see that we have a percentage of individuals, and we call this a minority in the sense that it's a smaller percentage, that have concerns about returning to school. And I think we have to just be really careful as we look at this data, that we consider that these are not just statistics, but there are individuals behind every one of these statistics. 7% of our instructional staff are concerned about that return to school and likely to return to school. That 7% represents over 1,000 of our educators. If I look at 13% of those parents and representing students, that's 20,000 students who have concern. So when we look at the statistics, let's just keep it in context that there are people behind statistics, and I don't want to overly objectify this. So that first tension is anxious to get back, but we have to keep in mind that we've got all kinds of folks out there. The next tension, and again, Ellen, I would just encourage you to jump in anytime you want. The next is, I am concerned about my child's or my student's health and safety upon returning to school. And again, we see a fairly consistent distribution. Parents may be a little bit more concerned here than some of the others, but these are folks who are saying, what are we going to do? Actually, the parents are a little less concerned in this case, because this is, I'm concerned about my child's health and safety. Parents are less worried than the teachers are about those kids. Parents understand the resiliency of their kids, I suppose, in that case. But the tension is really around safety and the safety protocols that are important there. And I can't overemphasize the importance of making sure that we get that right. And the importance, again, to be sensitive to all of our constituencies out there. We've got, percentages of whether it's educators, district leaders, in this case, a little bit higher, and parents with as many as 20%, a little bit concerned perhaps about what those safety protocols might be and how we can protect the health and safety of their students upon returning to that learning environment. So the next slide that I want to focus on, and this is a little bit busy, so I think we'll try and slow down and go a little bit slower on this because there's a lot of information here. Basically, if you look at the different color bars, the red bar are the parents, the blue bar are the instructional staff, the green bar are the district and school leaders, and the pink bar are the student wellness providers. And this is in hierarchical, ranking of some of the safety measures that different constituencies thought were important. First among those is really temperature checks generally was the highest. And this is, how do we screen students when they're coming into the school, whether it's through an oximeter or through a temperature check, to make sure that we are not having individuals who may have a COVID infection coming into our buildings. Social distancing was the next measure. Although you can see a fairly significant disconnect in terms of the desire for social distancing among instructional staff and wellness and leaders and parents. And then as well, when I look at class size reduction, again, a disconnect between the parents seeing a little bit, less of that as important compared to some of our school leaders. And I think actually that kind of theme flows to all of these as we consider them. And so these measures that we're looking at, I think it's, what it shows is that people are interested in making sure that we have appropriate safety measures, safety protocols in place, but that there still is some difference and disconnect in terms of, what those might look like for the individual students. Two things that I thought were interesting is if I get down near the bottom, there's the two from the bottom three, one is none, is remote till more testing and remote till vaccine. Those are still fairly significant percentages of our populations in terms of saying this is what they're considering. And so again, knowing that that's a minority, but still a fairly significant number of folks who are concerned about that, I think it's important for us to consider. I think the next slide will tie in as well in terms of, social distancing and challenge. So, this is in the returning to school. Students will be able to maintain new restrictions, such as social distancing, avoiding congregating in groups, avoiding physical contact with peers, and other safety protocols. And what you'll find is that there is fairly strong agreement that that's going to be difficult to do. And I think one of the important takeaways from this feedback that we have received is that we need to be very realistic about our students and how safety protocols that we put in place are potentially going to play out. It is very difficult for students to socially distance. The research and the studies tell us, and I know that many of people on the work group, because this is where I heard some of this information, it's very difficult for students to effectively use a face mask. And in some cases that may even cause, adverse effects because they tend to fiddle with the face mask and touch their face more often than they should and increase the possible risk. I think what you can see here is parents do not have a high confidence that students can maintain social distancing. And I think our instructional staff would agree with that as well. So as we're pulling some of this information together and looking at that, this is another one of these tensions that I think are important for us to consider as we figure out how we can create good, solid, usable information for our school leaders. And then the last slide, and actually a couple more that I'm going to touch on here is, we go to number 5, is relative, and Ellen, if there's any point that you want to jump in, feel free to just like unmic and jump on me. Okay. I have access to the PPE materials, thermometers, isolation space, masks, face shields, gowns, cleaning supplies that I need to do my job safely. And I think in any scenario, we need to ensure that the PPE supply chain is something that we can feel confident in. I can tell you that that's something that the department has been paying a lot of attention to and is closely monitoring. And we understand our role in working with Homeland Security to make sure that there is a reliable supply chain of this equipment in the event that there's not commercially available supplies for our schools. If we make a recommendation on face masks, we need to make sure that those are either readily available in the commercial marketplace or that we are supporting the supply chain for the schools. I can tell you that we did some estimates across a variety of different PPE supplies and have provided that to Homeland Security at this point in time and are working through those supply chain needs and what that might look like. So again, recognizing the importance of this, but also recognizing that if we are recommending to our schools to do something, we need to make sure that we enable them to do it as well. We can't just give them something that they can't succeed at. That's not fair. And then the last thing that I really wanted to take a look at, another tension that exists out there, is student anxiety. My child's students' stress and anxiety levels have decreased since transitioning to remote learning. And I think what we can see here is that the majority saw increased stress and anxiety due to all of the disruption that took place. I think that's not a surprising statistic, and I think it's consistent with what everyone's expectations were, probably having gone through a pandemic. I think this is the first pandemic that I've ever lived through, and I'm pretty sure that it's the first pandemic that most of our students have ever had to endure, at least at this scale. What is kind of noticeable is the percentage who have had lower stress. And again, recognizing, so these are parents have recognized lower stress. We've got some instructional staff and some district leaders, as well as some wellness folks who have recognized that reduction in stress. We want to make sure that these are not just statistics, but they are individual students, recognizing that these are thousands of our teachers who found that environment to be less stressful to them. This is over 35,000 students who found the environment less stressful to them. So how do we accommodate all of our learners as we begin to figure out how to put all of this back together? So those are some of the tensions that we saw in the data. I know that you all saw much more data than this through your work groups in terms of looking at the actual granular level. What this is AIR kind of pulled together and said, here's some of the areas of tension between different aspects of reopening in September. And we wanted to just put those in front of the task force as we begin to formulate some of these recommendations so that we can understand what those tensions are and how we can develop recommendations that are responsive to those. And so, Ellen, I will hand it over to you. And we both got cameras now, so we're good.
Great, thank you. I appreciate the overview and the sharing of some of the survey findings. To your point, these were not just tensions that we had identified, but rather the work groups really pulled them out as they were doing that review, sort of thinking about what types of recommendations would be most beneficial for New Hampshire schools and districts. These were some of the tensions that they grappled with as they tried to develop up their own recommendations. So we thought it would be helpful to summarize and share with everybody, not just those task force members, because that's really a lot of what informed the recommendations that we're going to be discussing this morning. I guess it's still morning. So actually for the rest of today's meeting, we're really going to look at some of the draft task force recommendations that were developed. These were informed directly by the work group recommendations. So of the 6 work groups that were convened over the last several weeks, the groups came up with over 100 specific recommendations, some that focused on the topical areas that they were addressing, such as operations or technology, but there were also a lot of cross-cutting recommendations that sort of filled into or spilled over into other work groups. And so over the last week, after the last round of work group meetings, our team, in conversations with the New Hampshire Department of Ed, looked at across those 100+ work group recommendations, tried to categorize them, pull out themes, some of the findings, and what we're going to be discussing today is actually that work that we did. Before we get into the specific task force draft recommendations, we thought it would be helpful to sort of summarize some of the themes that we saw from the work group conversations and from the recommendations that were developed. And this really directly informed how the draft recommendations were organized and worded, and some of the specific components and actions that were suggested in this work. So the first, is the commissioner already mentioned, there's a strong desire to come up with solutions that get students and educators back into the classroom. The second was that there was really a call for the New Hampshire Department of Ed specifically to identify what types of recommendations were required, what were some options that could be considered, and then what are some examples that district leaders could pull from. The third was to acknowledge that there are no 2 situations within New Hampshire that are exactly the same. And so there is a need to allow local flexibility in return to school decisions, and that should really reflect the local schools' situations, their specific values, their capacities to do this work. As the commissioner previously noted in the survey analysis overview, there was also this tension that was discussed and explored around implementing health and safety protocols that are coming out not just at the state level, but the federal level from the CDC, from other agencies, with the ability to practically and realistically implement those types of responses in the classroom. And so that was a tension that was discussed across the work groups and was reflected in their recommendations. There was also a broad acknowledgement that there will likely need to be some type of hybrid school schedule that balances in-classroom instruction with remote instruction. And so to that end, sort of thinking about how you can leverage what was learned in remote instruction over the past spring to really implement best practices and share those lessons learned. Also, number 6 here thinks about in preparation for the identification of positive or suspected positive cases in schools, it's really important to develop some response plan that can help communicate strategies, protocols, expectations around those anticipated positive cases in schools. And then jumping down to the last one here, the work groups really spent a lot of time, particularly the student wellness work group, acknowledging and thinking through the implications of what has happened over the spring for students, that this has really been a big shift in how they have learned and how they interact with their colleagues and their educators, their teachers. And so thinking about how to address the mental health and wellness of not just the students, but also of educators and other staff when school returns in the fall is really a priority from that perspective. So from the review of the specific recommendations that the work groups developed, the work that we did sort of over the last week was to try to group them into some overarching, actionable and useful recommendations for school and district leaders. And so we came up with 10 that sort of encompass the broad scope of the work from the work groups. But within each of these 10, there are more concrete sort of sub-actions or sub-recommendations that help really contextualize and help promote action for implementing these recommendations. So today's conversation, as I already mentioned, we will go through these 10 recommendations as well as the sub-actions or sub-recommendations that have been developed so that we can really get a sense from the task force members what is missing, what is unclear, and sort of how we can further finalize and flesh out these recommendations for school and district leaders. I will say that once these recommendations by the task force are finalized or considered finalized by the task force at our meeting next week, the New Hampshire Department of Ed will take those recommendations and further add context and nuance and options and considerations for districts. So this isn't sort of the only type of information that will be available, but rather it will be further fleshed out and some more robust considerations will be included to sort of contextualize the recommendations. So for task force members only, yesterday I shared a document that lays out these recommendations and sort of the sub-actions underneath. We recommend that you sort of have that handy as we go through this next part of the conversation because it will really sort of help inform maybe any of the feedback that you have or the discussion that you want to contribute to the recommendations review. And just for context, I know I shared this in writing, but that document that I shared, the first part is all of the recommendations and the sub-actions sort of up front. And then on the back end, what you'll see is the crosswalk that maps each of the work group's specific recommendations to these overarching 10 recommendations and sub-actions. So you can sort of see how the work of the work groups really informed these draft recommendations. Now, we have some guiding questions for the work groups to consider as we go through these 10 recommendations. We're not trying to limit your feedback on these recommendations. So these are very helpful for us to be able to know what sort of content and context to add as that final document of recommendations is developed. But if you have other feedback beyond these 2 questions, we're not trying to limit that conversation, so please feel free to share. We are going to try to avoid wordsmithing as much as possible at this meeting. If there are glaring issues or really things that should be considered, we absolutely want to have that conversation. But we will have time in our last meeting to look at what is done today and sort of do that wordsmithing in a more detailed way. So I just want to say that up front. These questions aren't intended to limit what we're getting feedback on, but rather definitely questions we would like your thoughts on and anything else that would be useful for us to consider. Before I jump into the first recommendation, Commissioner, is there anything that you want to add to set this up, or do any of the task force members have any questions that would be good to answer before we jump into this work?
So the only thing that I think is valuable, and I've appreciated, and I think that the task force members will also, is the way that you've kept continuity in terms of taking from the most granular, work at the survey to the work groups and up to this level. So we're keeping continuity through the whole process. And I think that that's an important aspect of how you have pulled this together. So I really appreciated that because it was easy for me as I was walking through some of these recommendations with you yesterday as we were talking about them, and you could just show me, here's the information that we saw in the survey, here's how the work group interacted with it, and now here's what we want to present to the task force. So thank you for that.
No problem. That was the work groups. We just recorded it, so thank you. Any questions from task force members about sort of what we're going to be doing next? And really, this is where we stop talking and we ask you to share your thoughts and feedback. Okay. So just task force members, I know we mentioned.
Let's give them something, Ellen, to sink their teeth into then,
Sure.
right? Exactly.
Yep. Yeah, we can start there. I just wanted to do a quick reminder. If you, when you want to speak, if you could just join on camera, it's a lot easier for us to sort of know who wants to share, who wants to say something, and sort of facilitate the conversation. So if you're able to do that, that would be great. And let's get started. So the first draft recommendation broadly discusses establishing district and school management and communications plans. And within this, the sort of sub-actions or the sub-recommendations are that districts establish a district leadership team and that they develop and implement a family and community communication plan.
So maybe Ellen, just like refresh those questions again for everybody so we know what to do that.
So the first question, is there anything that's missing from this overarching recommendation? And then do you anticipate any challenges with implementing this guidance? Or is there specific types of information that you would like to see within this recommendation that should be included in that final document? So Phil, I see that you have joined on camera, which makes me think that you might have some ideas. Go ahead.
I'll break the ice. Someone's going to start.
Great, thank you.
If you could go back to the recommendations.
Yep. There we go.
So when I read the overarching recommendation, the district and school management and communications plan, but the sub recommendations only really speaks to the communication plan. So I wonder if we could put more detail into what we want a management plan to, right? Like, is it courses of action? Should you have a positive? Courses of action? Should we enter a second wave? Just any specifics around what we're asking the management plan to be about, I think would help school district leaders.
Okay. And I just wanted to respond to that. So we do talk about some of those items in future recommendations. And so I just want to put a pin in that, because if that's helpful information to like circle back to and make sure is included in this recommendation, we should do that.
Or annotated in the future recommendations that this is something that should go in the management plan. Just something to make it easier on them so they're not playing like a guessing game as to what goes where.
Sure.
I think that makes a lot of sense, Phil. Yeah.
Yep, I agree. Deli, was there something that you wanted to add as well?
Yeah. So for establishing a district leadership team, could we give examples of who we want to serve on that team? For example, somebody representing the mental health workers in the school, or are we reaching out to community mental health centers to serve on that team? Do we want students on that team? Could we just get a little more specific about what roles we'd like to see on that team? Thank you.
Yep, and I heard you mention a couple which we've recorded. Are there other recommendations that the task force members would suggest should be on that district leader team? Either Deli or others.
Well, definitely some teachers and staff representation from different staff members. For example, maybe the nurse or OTs, school social workers. Just want to make sure we cover the gamut.
Great. I saw some comments in the chat as well around high school and elementary parents, so I've added that list. Amy, I see you raising your hand.
Or maybe to include the health representative from the health department or the local emergency operations center team. So developing that clear communication line with the city partners as well.
Great. Erin?
Hi. Yeah, from the technology standpoint of things, you know, where we are with the SAU, we have the building technology person, which would be myself, but we also have someone that's working as a system administrator for the entire supervisory union. So keeping a dialogue between our individual districts in the supervisory union, but also utilizing the either technology integration specialist or IT people within the district to help coordinate this and kind of increase efficiency. We're working on such limited time that some things should be communicated through these team meetings at a scheduled time, like something like this, whereas many other things could just be sent as an email to increase efficiency and free up some time. So I think that's really critical. We think about that.
Great, thank you. Anything else related to this first recommendation? Okay, I also saw Carl's comment in the chat around recognizing that many people wear many hats, or there's fewer people that wear many hats, and so thinking about the implications for small communities as well in these recommendations or in the suggestions of members. Thank you.
Can I ask Carl just a clarifying question on that?
Sure.
Is the concern there to recognize that we can get one person who can cover a lot of ground, or is it like, let's not overwhelm these people, or is it both of those maybe, Carl?
I think it's probably a combination of both of those. You have some small communities where the emergency management personnel, you've got a police chief, you've got a fire chief that's probably a part-time person and has another job, whoever runs their ambulance services and those kinds of things. In small communities, it's really difficult, even when we're planning school emergency response plans, to get those folks to come into the building and attend team meetings because they're so stretched. So just something to keep in mind. That's going to be an implication for implementation.
Got it.
Okay. Thank you. Okay. Aaron, were you going to share something?
Yeah, if I could add just one more thing really quick.
Absolutely.
We mentioned in the crosswalk, district leaders in schools should develop a communication plan and strategies to engage parents. One of the really hard parts we found is, you know, that gap is growing with our students, but it's also that investment of the families. And so it seems really difficult to get that added investment from families that are kind of already have that separation, or they're wearing many hats and they don't have time. So figuring out a really, again, streamlined course for them to be able to get in quickly when they have a free minute to either figure out what the new communication is from the district or something to just streamline that to make it even easier. I mean, I know that's what we're always aiming for, is to make things more efficient and easier to use, but just ensuring that extra piece, because we can go that extra mile, but it's those people that already were having trouble that we really need to grab and pull in.
Great. It's a great point, and definitely something that examples or suggestions on what that streamlining could look like will be helpful to include. Thank you. Anything else? Well, we can certainly come back to this as we discuss the others. If there's something that jogs your memory and you say we should really add that to recommendation 1 or one that we've already talked about, this isn't your only time to reflect and add to. So let's move to the second one, which is really about determining public health protocols. So this one has 4 sub-actions for consideration. So the first is to follow the guidance from the New Hampshire Health and Human Services and the Governor's Office, and then also to consider the guidance that comes out from the CDC. The second is to adopt policies for screening staff, students, and visitors prior to entry of the school. The third is thinking about adopting policies for social distancing and gatherings for instruction and other spaces. And then the final one is to develop a response and communication plan for the identification of a positive case or a suspected positive case. So again, opening it up to the task force members to think about what is missing from this recommendation, or what challenges with implementing this recommendation you might anticipate, or any other feedback similar to the first one that would help us further ensure this is a robust recommendation for schools and districts. Hi, Ben.
Hello. So the first thing I thought of when I looked at this, and this is something Mr. Ederblue brought up in one of our meetings, is that it's not too hard to social distance if you're in a lecture, but when you're in the hallways, like getting stuff from your locker, for example, or in the school bathroom, it's going to be really difficult to implement social distancing measures which are effective.
Thank you, Ben. Okay, Phil?
So I think I'll add on to what Ben was saying. Obviously, we have to be realistic as to what's implementable. And like if you're gonna have a policy, you're gonna have to be able to enforce the policy. So who's doing that and what time commitment is of that? I think there's, we also need to look back at the data that the commissioners showed us as to like where social distancing fell and like what percentage of both school leaders and instructional leaders and parents actually saw that as something that was necessary. And the scale, if you noted on that, was only up to 70. So you're looking, it's less than 50% of parents, and I think right around there for instructional leaders and district leaders that see this as something that is necessary inside that space or inside of it. So I just think that we need to consider how realistic it can be, and that what the data is telling us, how many people actually are pushing for that within the school.
And so if this is coming out as a recommendation from this task force, are you suggesting that the context or sort of additional information that's provided under this sub-bullet 2C, that school and district leaders consider the feasibility of implementation, or are you giving that feedback to us as folks who have drafted these recommendations?
So yeah, I don't think they're mutually exclusive. I think that like we might be able to take the recommendation and make it broader if necessary. I think we obviously should allow schools to make decisions for themselves and districts to make decisions for themselves as much as possible for what's right for them. What's happening in Nashua is going to be different than what's happening maybe here in Newmarket. So I think something that might be broader than just saying adopt policies for social distancing that allows those district leaders and even individual school leaders to make decisions that are realistic for the spaces and places that they operate.
And so I'm going to put you a little bit on the spot. Do you have thoughts on how to make that broader, or what you might like to see in a broader? Well, I'm just thinking, like, is it changing adopt to consider? Like, is that sufficient, or are you thinking?
Yeah, maybe consider policies for social distancing and gatherings for instruction and other spaces that as appropriate for your school or district or something like that, that puts the onus on them. They know their buildings better than we do. They know the characteristics and what's happening inside the communities as in terms of COVID better than we do. To say just strict adopt is, I think, perhaps a little heavy-handed, where we might have a little more elegant approach.
Okay, great. Thank you. Aaron?
I think just going off of those policies and just remembering that we need to be cross-cutting this to the social emotional wellness of our students and the staff in the school. When we think of a lot of these policies, we've all experienced kind of how draining they are on our social emotional health. I'm always connecting every plan we have or theory we have to our kindergarten students, and how would that experience be for them? Social distancing for kindergarten, the idea of wearing masks. You know, we have students who are sitting there chewing on their headphone cords while they're using the touch screen, and they're sharing computers. So when either the districts or the task force is coming up with these policies, really thinking about what's feasible, but also what is that effect going to be on social emotional health. I've been working on sourcing masks for my school that have a positive image on them, you know, anything that can be done in that regard to help improve the social emotional health while allowing us to continue teaching and working within these schools. I think that's really critical.
Great. Thank you, Aaron, for sharing those concrete examples and some nuance or context that could be added into this recommendation to really make it appropriate for different contexts. Carl?
I don't disagree with what anyone has said up to now. I do think that we need to say that we should adopt policies. I don't think that it should adopt a one-size-fits-all policy, because that will not work. But I think to put the onus onto the districts to actually say, you as a school leadership team with your school board and with your communities, you need to have policies that everyone understands, that everyone abides by, that everyone can look to for some guidance. I think one of the things that comes through the feedback from all the work groups was the need for clear guidance coming from the department and from the state. And I think that, yes, we need to keep it broad enough so that we can make sure that we meet the needs of all the stakeholders, but we do need to put some guardrails on it so that we have some concrete guidelines coming from the department. And I think when we're talking about public health, there should definitely be something concrete at the district level. So that's my 2 cents worth.
Carl, can I just weigh in on that a second? I'm wondering if there's some, and maybe even Phil wants to jump back on just so we get some clarity around how we can help with this. Because I'm hearing Phil, like, we don't want to be telling people we got local control, right? So are you, and I understand what you're saying as well, like, because policies are going to differ, to your point, like everybody's got to adopt a local policy that fits their circumstances, I think is what you're saying. But I think what you're concerned about, so if we say consider adopting a policy, then they may be like, do I need one or do I not need one, kind of thing. And so I think what you're saying might be consistent with what Phil's saying, in the sense of, if it said adopt a policy around social distancing that fits the needs of your school community, is what you're after, more than, but you're saying you want to have something, is what you're saying. Is that right?
Yes, I think that if we just consider a policy, or if we just consider adopting a policy, there are going to be some school districts and some communities that may just say, we don't want to deal with that. We don't want to deal with it, and we're just going to make decisions within the school. I don't know if there are that many that would actually do that. I'm just saying that if we're going to put forward guidelines from the department and from the state, I think they need to be as clear as possible.
So just to be clear, these are guidelines to the state. These are what we're going to recommend for the governor as well. So, and I'm sorry to skip over Delhi, but Phil, do you want to just kind of weigh in on that, since that you started that conversation?
Yeah, I think that I'm not asking for lack of clarity, but I'm asking for flexibility as much as possible for the local landscape. So, I mean, I don't think Carl and I are saying diametrically opposing points. Maybe, like, I would argue for greater flexibility at the district level, and he would argue for a different level of guardrails. Probably every member of the task force would have, like, their idea of what the specifics of a guardrails would be, which is why I think providing guardrails that are not as heavy-handed as possible, so that local districts can make the decision within their space. I also think we need to be clear in this as to, like, what are the triggers for this, right? Like, we say put in adopt policies for social distancing. Like, there has to be some, like, when does that end, right? Like, are these ad infinitum, or is there some sort of, right? So I think something in there needs to be talk about time triggers or condition triggers for it. I will stop now. It's Delhi's turn.
Delhi?
For letter B, I wanted to somehow make districts aware that adopting policies for screening should not fall specifically on them, that parents need to have a role in that, and they should be screening their kids first thing in the morning and not putting them on the bus if they have a high temperature. So I don't want districts to think it just has to be their responsibility. We need to give some of the onus to parents to do some screening at home.
Mm-hmm. And I think too, I think it was Phil's earlier point, maybe it wasn't Phil, but making that connection explicit in this recommendation to that communication plan in the first recommendation. So what are some of the expectations for the community and parents related to this as well? I think that's a great cross-reference there.
Great, thank you.
Keith. Oh, I think you're on mute.
So just following up with what Carl was saying, I think of everything from a parent perspective and a teacher perspective, but I just want to feel confident that there's not too much leeway with following or the policies with social distancing and gatherings. It all goes back to for me, if we are following the CDC guidelines and the Health and Human Services guidelines, then I would feel confident as a parent. I would have angst as a parent if there was too much leeway with following guidelines.
Okay.
I would agree
Thank
with
you.
that. I think what is safe in one district needs to be safe in another district because it sends a very mixed message of the seriousness of COVID-19. But if, you know, some districts are allowing certain things and other are not, I think it will pose some challenges for them.
Thank you, Amy. Phil?
So probably not a surprise. I don't necessarily agree with that. I think the conditions can be different community to community, county to county. And if we say that the North Country has to live by what like an urban environment lives by, where the conditions around COVID might be very different, I think that's a one size fits all approach where we're very different community to community and the conditions are going to be different.
Keith or Amy, I don't know if there's, I'm not trying to put you on the spot, but I want to give you a space to respond.
I just want to make sure that, so if the CDC is saying that there should be no more than 10 people per room, I don't think it matters where in the state you are. I think we need to follow that.
So I think actually in these, we actually say consider CDC guidance. We're actually saying follow NHS guidance, consider CDC guidance. So we're not even saying as a task force, at least not yet, unless we edit this, that people have to follow CDC guidance. We're saying follow the state guidance, which again, because our context is different here than the nationwide guidance CDC is putting out. That's just my perspective on it.
Yeah, I just want to make sure that I know numbers up north aren't nearly what they are down in southern New Hampshire, but to me, I don't think that we should, you know, lower our expectations or lower our guard because those numbers could increase no matter where we are in the state.
Erin?
I would agree with Keith. I'm sorry, I didn't pop on the camera.
Is that you, Amy?
Yes.
All right,
So
thank you.
I will add the one component to it too, is that we have to consider the data that said how realistic is it that students are actually going to follow social distancing guidelines? Are they going to congregate in groups? Are they going to, so we could write all the recommendations in the world, but kids are going to do what kids are going to do and they're going to congregate, and there's going to be a lot of that happening regardless of whether we say you're not allowed to congregate in the hall.
I think that, sorry, I can't get on camera. This is Catherine Plord. I do think that we need to have some baseline expectations though. And I hear what Keith's saying, I hear what Phil's saying, and Carl's chimed in. I think there needs to be a set of baseline expectations that districts need to be consistent with, and such as, you know, whether they're coming from DHHS or CDC, I think we need to be consistent with those practices because we are talking about public health and safety, and we're not talking about where we all live. We're seeing the data and the uptick and the increase all over the South right now because of opening guidelines and the ways that they open their states. So we know that when groups congregate, this spreads. So I think that we need to make sure that there's some baselines, and then it leaves room for particular districts or counties to really look at where are you right now and what are you able to manage given, you know, where you are at. I think we've done a great job in New Hampshire, and I want to keep that going. As I mean, we stand out, I think, in terms of how our state's been managed, and I want to keep that. I want to keep that in place for us. So if we start going rogue with some of our decisions based on individual districts, that could make our data and our student safety would be at risk.
Thank you. Erin?
I think being up in the North Country and being in this kind of bubble of where it kind of seems like the pandemic hasn't hit as hard gives an interesting perspective. And having that bit of having the control locally, but also having some minimal expectations, you know, what are you going to do for that first line of defense? Maybe it's universally we need temperature checks. But when it comes into what the actions are within the classroom or maybe in the hallways, that can be left up more flexible to the schools and the districts to come up with that plan, as opposed to forcing something on them. I mean, the word consider is good in some ways in that it allows people to have that flexibility, but it also feels somewhat loose. I know there's probably 50% of people really like going off of what the CDC guidelines are, and the other 50% want to do their own thing. I'm sure we've all locally seen that reflected when we go into different businesses. The restaurants are showing kind of where they want to be, but we need to remember that we're not only protecting the students that are coming into the school, but we need to be considering the other faculty that work in the school and their comfort level. So if we're leaving things loose and letting the schools decide, and there are certain people not represented in the district leadership teams, then they may feel differently as to what the school decides versus what they were expecting, because they were assuming they'd be coming back to CDC guidelines being what their school is based on. So really a roundabout way of saying that maybe having some, like what was just said, having some minimal guidelines, and then different schools and different locations can maybe crank it up a little bit depending on their personal situations. But I think that hybrid model idea is kind of going to be the direction this needs to go in. As we've seen in the statistics, you can't please everyone.
Mm-hmm. And so I'm just throwing this out there. Feel free to throw it right back. If we revise C to adopt policies for social distancing and gathering for instruction in other spaces that consider, and then identify some specific considerations that should go into informing the specific policies that the district would then adopt. And some of those things could be cases in your area, feasibility of implementation, impact on the social emotional well-being of students. Like there's some specific considerations that would be explored concretely by the district team or whoever is making this decision. Would that sort of suffice in making sure that there is a appropriate level of discussion and review of key items by the district, but also really is allowing for that local flexibility based on that circumstance? And I saw Aaron give a thumbs up. Bill says that works for him. Keith and Amy, I'd love to hear your thoughts on that. And then Mike, I will get to you too.
I think that sounds good, Ellen.
Okay.
I'm fine with that as well.
Okay. All right, great. Any others? I didn't mean to limit to just those folks, but I know that was sort of the main folks who were trying to debate that, or not debate that, discuss it. Okay. And Mike, I like I said, I wasn't trying to cut you off. What, yeah, do you want to share? Oh, you're muted. On your screen, do you see right under your picture a red microphone? Oh, okay. Oh, muted by the organizer. Jessica or?
All right, we're good now. We're good.
Oh, okay. All right, great. Yeah.
Good morning. I think this task force should be making clear recommendations on things that can be implemented. And so I would be hesitant to make recommendations on things that we can't enforce and school districts and schools can enforce. So as you're thinking about it, I agree with what you just kind of presented a few minutes ago, but just be really clear about the things that are enforceable. Like, maybe it's temperature, maybe it's waivers, maybe it's screenings, but to take a hard line on social distancing and things that we know are not going to be implemented across the state, I think that'd be misguided by this task force to make those recommendations.
Okay. Thank you, Mike. Okay, I'm going to move us on to the next one. So this next one is focusing on preparing the school environment. So again, this is where the district would determine the use of PPE, including who will use it, what training is needed, and how it's procured. promoting a culture of good hygiene, hand washing, sneezing into an elbow, avoiding long periods in close quarters with large groups, evaluating school cleaning practices, reviewing the policies for school building use for non-school functions, and then evaluating schools' ventilation systems to mitigate spread. Hi, Ben.
Hi. So for the PPE section, in the student voice task force, it seemed like a majority didn't want to necessarily enforce PPE on students to make them wear it. I texted a bunch of people and tried to see like how many people I could possibly see think that it should be enforced to wear it or not. And it really seems to depend on both your politics and how urban the area is. So I think students are mixed on whether or not it should be enforced upon them. But it's really hard to do that with younger students, like kindergartners. How are you going to make them wear a mask?
Thanks, Ben. And thanks for doing that research on your own. Aaron.
Just to put the thought out there of, you know, is the idea enforced when they're physically in the school and they have this alternative, which I think we're going to talk about a little later on, of the hybrid model of if one of the policies doesn't fit what you're comfortable with, then you work remotely, and we have something to facilitate with that remote learning. Again, when you start considering the hybrid model and the remote learning, you're putting more of a workload on the staff and the students, and possibly increasing the stress level. But always remembering that giving a choice is so ideal, especially in the state of New Hampshire. Having that opportunity to give people some choice regarding what they're doing. But again, considering just like what was just said, some of these practices may work really well with different age ranges and different groups, and maybe even within a school. K1, in my school, we're K6, maybe K1 has totally different regulations than 2, 3, 4, 5, 6 and the expectations. But also relying on the parents to monitor their students before coming to school is going to be really difficult. I mean, before the pandemic, we were having kids that were coming in sick, whether it was the parent not recognizing it beforehand or they just didn't have the capabilities to keep the student at home. And I don't think that's going to completely disappear with this. So I think we need to keep that in mind.
Thank you. Deli?
I'm just wondering if we need to get specific about saying prepare the school physical environment or building environment, because that's going to be very different from the social emotional environment. So do we need to differentiate between those two? Don't mean to be wordsmithing, but.
I think that's a good piece of feedback, and from my perspective doesn't change the recommendation at all, but rather helps clarify. So that's fine with me.
Just gets more specific. Yeah. Great.
Yep,
Thank
I think
you.
that's a great point, especially because another recommendation deals with the wellness part. So
social emotional. Yep.
Yep.
Thank you.
I don't know who came on first, Phil or Keith, so looks like you, Phil.
So one, I just want to second that it's the physical environment, not the social emotional. I think that is absolutely critical, because I think those are two very, very different things. So Deli made a fantastic point there that I support. And actually the language in this first one, determine district use of PPE, like that's much closer to what I was thinking about with the social distancing, that like the district can make the decision inside of this, right? Based on what's going there, training, procurement, all that. So I think that's actually like decent language for it. I recognize too, I think it was Aaron that said it, right? Like, I think there's an age thing to it, right? But again, the districts can make that decision. Kids are going to fiddle with masks, and you know that reduces any sort of like use of the mask because they're playing with it or they're chewing on it or whatever. So I think that like perhaps this type of language is something that you can consider as you're reworking the last one too, not to relitigate something we talked about for 10 minutes.
That's okay. Thank you. Keith? Oh, you're on mute again. That's okay.
So I don't mean to wordsmith either, but PPE to most of us means like medical grade masks, gowns. We think of hospital type PPE. So I don't know if I think what we're referring to right here is really face coverings, right? Just like either fabric face coverings or non-medical grade face coverings. So I don't know if we need to be a little more specific.
So I think, and I'll need to relook at the recommendations from the work groups. There was, particularly in the student wellness group, and I think a couple of nurses in the instruction group talked about it beyond that, particularly for nurses or other staff that might be dealing directly with sick children. So whether that was face shields or I think it was their mom, there was like a bunch of items that were bucketed into that, but regardless, I think being more explicit about what that PPE is referring to, I think would be helpful clarification in this recommendation. So could include that as well. And Commissioner, I don't know if there was something you wanted to add on that.
Well, I think that Keith makes a good point in terms of that, like we have to think about that definition very broadly, not just in the medical context, because you're right, there are certain instances where we're going to have medical grounds, or there's going to be in the nurse's office certain protocols that are different than in a classroom. So.
Yep. Ben.
I just wanted to add something really quick to what Phil said, which is from what I found, there are a lot more people who are interested in wearing masks in more urban areas. So if like how strict wearing PPE is, I think that's something which would make sense to depend on the area because there's definitely cultural differences depending on where in New Hampshire you live. And yeah.
Okay. Thanks, Ben. And Phil?
So it's a conversation that was had in our working group around there's going to be some families that are just like, my child is not going to wear a mask, right? Like, so if a district has that, so I think that like maybe I don't want to get too heavy-handed again in like what we're saying here, but like what goes into what their use is going to be. Like, what are you going to do if there's a child that doesn't wear it, right? So I think that there's contingencies that the district's going to have to plan to. I also think that even though this is the physical environment, and I support putting that here, there's a social emotional component to saying everyone's going to wear a mask, right? That I think the district should work into the district's consideration potentially. As you got a bunch of primary school kids or elementary school kids. What's that social emotional impact of being told they have to do that vice maybe high school or whatnot?
Mm-hmm. Okay. Thank you, Ben, for your comment around access to things like masks for different students, their ability to have access to them, whether affording them or making them. Okay. So I definitely heard a call for more specificity around those considerations, adding out a broader definition or defining PPE, and thinking about the implications for what happens if these protocols are not followed, and then also changing the overall recommendation to the physical school environment. Okay, I'm going to move us on to the fourth one, which is around supporting student, family, and educator wellness. So develop a plan to support the social emotional learning for students, consider outreach programs for at-risk students, establish mental health resource partners to support students in need, the families and educators, and then thinking about how to coordinate services and supports with community providers, including those that provide mental health services, telehealth services, and meal services, both in person and in a remote or virtual setting. So what would be considered missing from this? What needs additional clarification? Deli, yeah.
So I know that some districts do have that MTSSB framework. And I know others are considering it. So some already have things like this in place for their students. Excuse me. But what I feel is missing is that they're, or not missing, but maybe we need to get more specific about is making weekly check-ins just about mental health and wellness, teachers to students, as part of the curriculum. So, I don't know, every Friday for a half hour, I'm just throwing this out there, just devote that time to checking in on students' mental health and mental wellness. I'd like to somehow just incorporate it into the curriculum and make sure that there is a check-in every week to see how students are doing. I mean, we're going to know the kids who are really struggling, but the ones who are quiet in the corner, are we going to be checking in on them? So I'm concerned about the districts that don't have an MTSSB framework in place to already do that. You know, can we make sure that something like that happens? That was a little raggedy, and I apologize.
No, I appreciate that, and I think and I don't mean to speak for New Hampshire broadly, but I feel like that the weekly check-ins is a great type of example that we would include in this guidance. So I mean, it could be like, this is a thing that you could implement, or are you saying that you want that as a sort of its own recommendation that is done?
Well, I would defer to the rest of the task force, but I just want to make sure that it does not get overlooked, that it's prioritized. You know, and I had spoken to a number of professionals, including pediatricians and folks that have done this work before, and they all said no academics like the first week of school. Just prepare these kids socially, emotionally, make sure they know what's expected of them. So I'd like to also suggest that to districts that, you know, they really take the time to implement a good, strong support system for students before we even think about academics. You know, I talked to the top pediatrician, one of the top pediatricians in New Hampshire, and he said, you know, maybe 5 days for elementary kids, 3 days for middle school kids, and 2 days for high school kids, you know, just devoted to designing a mental health protocol or system for kids. So something to have districts seriously consider. Thank you.
Okay, Ben. Thank you, Deli.
So going off of the perspective of a student, I found a lot of these kids who, without a lot of contact with other students, their friends, they're a lot more stressed out. And so for kids like this, what was just recommended, I think would be good because it's more time for them to be with their friends. But I also know students who it's often almost like a lack of motivation. And so if you set up a meeting where they could reach out to wellness professionals, students, teachers, etc., it's difficult to get them to actually go to these because it's going to be presented to them through something like email, and we don't even know if they're going to check that.
Mm-hmm.
So we need to find a way to make sure that they can get onto these.
Okay, thank you, Ben. That's a great point. Catherine.
Yeah, something Ben just highlighted was something we found in our district related to student motivation. In some survey results we received, that students are more motivated when they're making connections with their teachers. So Carl already put it in the chat, but we've implemented advisories in the district and thinking about a recommendation around this, because what we know is connecting with teachers doesn't have to be for an instructional block. We can have connections with teachers be purely for the connection piece and checking in. So if we have advisories or if districts can look at an advisory model, that's one suggestion, that they can look at having a small cohort of students where they're checking in, you know, weekly or a couple times a week, depending on the age level, to see how students are doing social, emotionally, but also gives them a time to check in with how they're accessing all of their instruction or their learning. And obviously that happens in school or out of school. But I do think the connection with teachers is very important and motivating to our students.
Thank you, Catherine. Phil.
So a few things. One, I think about this in like sort of a stepped care from like my psychology background. The idea that point A to me is really that preventative step, right? Like, what are we doing to proactively help foster mental health within the children across the state? Like much like PE class is for physical health, like what can we do to actually like proactively help students with that mental health, maintain mental health and grow it? When I think the step two, like I really think our teachers are our front line of defense. They're the ones that are going to notice behavior change before anyone else. So like what professional development could we potentially offer to help teachers both note when there might be a challenge and know where to direct people, which really gets to point C here, that those resource partners across communities. And then finally, Carl put a point about like we should consider physical health and mental health on par with one another. I absolutely think that. And when I think that the whole district policy around everything, right, distancing, PPE, all that stuff, should balance physical health and mental health as to like what's the impact going to be on the students and teachers.
Great, thank you, Phil. I heard a lot of great things that I see going into sort of robustly building out these recommendations. I didn't hear anything that feels like there's complete disregard or need for major changes with these, but rather more nuanced examples what this might look like in a school or in a plan. Is that accurate before I move on to the next one? Or did I mishear something? Okay, Carl says that seems accurate to him. Yes, Keith?
Yeah, so I agree with Deli that these check-ins are just crucial. So one thing that I want to know is, are we going to make specific recommendations for kids that just aren't coming, into these meetings? And because I know each district handles that a little differently. Some districts have more staff and can do home wellness checks when we don't hear from a student after a long period of time. But I'm just wondering if how specific we're going to get as far as some recommendations for those kids that just never ever tune in, because those are the ones I think we're most concerned about.
And so to me, that would be 4B potentially, with maybe more description of what we mean by at-risk students, and maybe more concrete examples of what that outreach program or plan could include. So I see some need for further detailing out 4B from your point, Keith. Commissioner, did you want to say something?
No, I agree with you. And I think that's how I anticipated, because I think when I read this, I assumed that the work groups were talking about, when they talk about those at-risk kids, those kids that we either can't or have difficulty connecting with through the process.
Mm-hmm. And I think at risk could be the students that have just dropped off and no one's heard from. It could also mean students that have connected with but are really struggling. So it could be a broader definition of at risk, but adding some detail around what that student could look like. I see Phil agrees. Okay. We'll move on to number 5. Again, not your only chance for feedback on 1 through 4, but just in keeping us moving. So this one focuses on establishing hybrid capacity for delivering a hybrid school model. So the first one is to develop a plan for delivering in-person, hybrid, and remote instruction for the 2021 school year. Consider additional policies for remote or hybrid instruction. Consider implications of staffing models and staffing needs for the model that's adopted, so in-person, hybrid, or remote. Create a tiered response for potential building closures and transitions to remote instruction. Scenarios could include a few days, several weeks, or long-term transitions. Develop a plan for the use of common areas, and then consider different classroom configurations.
This is one of the areas that I see in terms of equity across the districts. So is the most concrete we can be, and whether, I don't know if we need to build in statewide programs to offer that with their learn and manage it system. But this area probably concerns me the most and will have the most impact on student learning.
Thank you, Amy. Keith?
Yeah, I'm just curious about different hybrid models and what we're going to recommend. I guess my biggest fear, and I talk to a lot of teachers, is that we're going to be expected to come back do our normal Monday to Friday job in person, and then go home and do some remote learning to students that are not going to be coming in. And that's a huge concern. That's a big ask of teachers. And I fear that we would lose a portion of our educators.
Mm-hmm. Aaron.
I agree. Going off of what Keith said, I mean, we're working and talking about people that are so incredibly dedicated in the education field. These are people that are going to go above and beyond. You have those families that haven't been responding since March, and they're still sending out the data. They're still sending out the information to those students, hoping that they're going to get something from them. So even if we implement something and we're saying, you're not going to be working more than your contracted hours, they're still going to push that extra time to make it happen or whatever needs to get done. And so, considering equity, but also figuring out they're going to be working those extra hours anyway. How can we make that easier for them to facilitate, especially when we're considering that hybrid remote instruction model, whether it means there's a camera in the back of the classroom and the teacher needs to be posing questions to the kids in the room and possibly the kids at home, or they're doing that extra work during their prep periods that they no longer have to work on things in person because they need to get something ready for remote learning. So that staff time equity, I don't think we can make more time in the workday. So it's figuring out how we can increase the efficiency of this. On a regular basis, I was seeing teachers working 10 to 12 hour days during the week because of this pandemic, trying to find time to fit everything in, whether it was contacting other students or coming up with remote learning curriculum that needed to be differentiated between different students. And that gap is only going to get wider as we go. And so it's going to increase the workload naturally as more students are either working remotely and struggling more, or coming into school but not getting that full fulfilling school session because the teacher's being split between two places. So even if we add the staff, they're still going to be pushing themselves more. And so I think that ties a lot back to the social emotional health also of the teachers and the staff. And then later on, when we get to that technology portion of the recommendation, I think there's a lot of tie in there in terms of increasing efficiency. Maybe it's coming up with a learning management software for each school specific. We don't want to add something new for them to learn, but giving them something that everybody could be working on, sharing ideas between, and just making things more streamlined, I think is going to be really key for this.
So this is one where I defer to the task force members to help guide us, is what you're all sharing sort of around, what does the teaching look like for a hybrid model, for example, if that's Monday through Friday plus. Is that something that the task force recommendations needs to address, or is that something similar to the other recommendations where we say, here are things that should be considered as you are developing out this plan? Sort of help us balance what you're asking for. Is it explicit in the recommendation, or is it more, again, these are the things to consider: staffing implications, time management, if you're teaching to kids and kids in the classroom and kids virtually at the same time, that your lesson plan is sort of prepared for that. Like, help us think through that.
I think the more specific guidelines and supports that we can give the district, the better. I know at one point too, we in Manchester looking to change our the learner management system, but how do you make those decisions now, thinking ahead for the next school year? The staffing models, if we're going to need to, like, thinking creatively about substitutes, that's another piece too, I think, in terms of staffing, student teachers, and other pieces. How will that look within there? And how best to use our resources that we have and potentially share those hybrid resources, remotely. Could we partner with other districts?
Okay, thank you. Phil?
So I get concerned about unfunded mandates that are going to turn into, like, you need to increase staff by X number in order to do this, right? Without like anything coming from the state to provide for that. I do think that, like, we could ask them that, hey, we suggest you have a plan for a hybrid model, like whether you have to be like partially for a few days, for a few weeks, or for a prolonged period of time. Here are the things to consider inside of that. and maybe there's something that the department can do with that extra capacity it really doesn't have around to help facilitate cross district partnering, like was just suggested, something that would allow resources to be shared in a way that we're not forcing unfunded mandates on schools.
Thank you, Phil. Mike.
Yeah, some that comes across my mind is I think it's going to be on the local districts and schools to consider like a reallocation of resources and personnel while considering the staffing needs that are going to be created, like teachers not willing to come back, and how they're going to handle that. And I think it's going to be some guidance from this task force that it's going to have to be determined at the local level to figure out how to appropriately make sure that teachers are not, overextended, and there's going to be some cooperation and collaboration between, the schools, the districts, and the unions, and it's going to look differently based on the resources that are available. And I think kind of like empowering districts and schools to figure that out, and while taking the care of the needs of the faculty and staff is going to be something that should be encouraged. I'm not sure you can make a policy around that. I think it's going to have to be considered differently.
So can I ask a question? Because Mike, you brought up something, and Carl and Barrett both brought up as well relative to the collective bargaining agreements. Is there a recommendation to school leaders coming out of this that you think we should make in that area? Because now the three of you have mentioned it, so.
Frank, I don't know enough about the collective bargaining agreements between each district. I just know that there should be some sort of collaboration and conversation in order to get through the 2021 school year and the COVID-19 and the pandemic, in order to make sure that the mental health and social well-being of the faculty and staff is taken care of. Because I agree with Phil and Aaron and Keith, the teachers were grossly overextended, 10, 12, 13-hour days, and that is not sustainable. So there's got to be some solutions that can be created to reallocate, resources and staff. And I'm not sure what that looks like at the different agreements. So I really can't help other than that.
I wonder if we include in that first recommendation, like the list of people that should be on the district leadership team, like representation from the collective bargaining unit.
Mm-hmm.
Like recognizing that like the collective bargaining unit and the administration are on the same team trying to solve this challenge together, and that like if they all had a seat at the table, they could work out what could work for their district and their particular agreement.
That's a pretty smart idea.
I mean, but at the end of the day, this is going to happen, right? There's going to be students, or there's going to be teachers who are immunocompromised and are not going to feel safe walking back into the building. And that if the district and schools don't have plans for that, that's when the problem's going to happen. So.
Mm-hmm.
Yeah, I would completely agree. You can't pretend it's not happening. You know what I mean? And it won't happen. So even though it will probably be significant, I think if you're going to go into a hybrid model, you're going to have to sort through it. It's substantial, I think.
Mm-hmm. Barrett or Carl, was there anything that you wanted to add to that? I know that you mentioned something in the chat around a recommendation related to collective bargaining agreements.
Thank you, Owen. I mean, nothing specific beyond what has been mentioned. I certainly don't have any answers, and I don't do bargaining myself, so the nuances of each collective bargaining agreement across the state are significantly different. But simple things like a work day may be defined in a collective bargaining agreement, or hours that the teacher has to be within the building, or somebody had mentioned prep periods earlier. Those are all defined by collective bargaining agreements. So if we're putting expectations on our teachers to work more, do more, and change the expectations that are found in their contracts, we're certainly hearing that they're going to want to bargain that. And we already know that some some local EAs have presented MOUs, MOAs to their school boards for modifications to collective bargaining agreements under, the state of emergency. And certainly hearing that some teachers want to do the impact bargaining to determine how these recommendations or changes are going to impact their local CBAs. So I don't have answers. I don't do bargaining myself, but we know it's going to be significant.
Thank you.
And I would agree with Barrett. I think that if we can at least acknowledge the fact that there are going, in a hybrid model, there are going to be it's going to be a significant impact on the typical working environment of what a teacher signed up for initially, and what the collective bargaining agreements currently envision as the work environment. The reality is that teachers are working very, very long hours and going way above and beyond. And that, as everyone has been saying, it's just really not sustainable for a long period of time. And depending on the hybrid model that the district chooses to go with, you could have teachers who are supposed to be teaching their traditional classroom for part of the day and then doing hybrid for another part of the day, or trying to do both. There are lots of different models out there that districts are talking about. So I think it's going to be really important that we at least acknowledge as a task force that there are some significant work implications for the hybrid model, that it's not just flip a switch and we go to hybrid and everything is great, because it probably won't be.
If I could just add on to that again, not to belabor this point, but no school district, school districts and school boards don't have the simple authority simply to mandate that teachers are going to move to remote or teachers are going to do some sort of hybrid. When the governor issued his emergency order, executive order back in March, teachers stepped up because they knew it was right for kids, and they were willing to do it, for these 3 months because they knew it was what was right for kids. While those needs are still going to be present come September, it can only continue on so far before concessions have to be made.
I think you also have to consider the variations of teachers that we have and what they teach and how they provide instruction. So if you're running a hybrid model and you have special education teachers, speech pathologists, et cetera, who are trying to service kids who are in and out of school, you're having other scheduling complications. So we're looking at this in our district, and we're trying hard to see how we can make it work. But there's always walls we kept hitting around the instructional day. What is the instructional day? How much can we ask of teachers, and also of parents and their scheduling, and trying to also schedule for their children if they're working or not available to assist with that.
Not to throw a wrench into things, but another huge concern of mine is I would wager to guess probably about 50% of the teachers that I know anyway have young children of their own. So if you, again, it goes back to what's a hybrid model. It looks so different maybe in many different cases, but if one of the hybrid options that districts use is that kids go on an alternate schedule, some days at home, some days at school, I have a very, very big concern that you're going to lose a lot of teachers because they're going to be in crisis mode. How can I leave my own young children at home when I'm being asked to be there 5 days a week? So just something to be thinking about.
Thank you. So sorry, Commissioner, did you want to say something?
I'm just trying to be cognizant of the time for everybody on the call and making sure that we have enough time to transition a little bit. So,
in terms of, so we are at the 90 minutes for today's meeting. So are you just referencing what we'll do to get the feedback on the remaining recommendations?
Exactly. You talked about a process for that.
Yep. Sorry. I just wanted to make sure we were on the same page. So yeah, so we are actually 1 minute over our 90 minutes for today's conversation, and the valuable insights and feedback that you have all provided, I think will make these recommendations that we did discuss much stronger and really reflective of what type of information, not just you all, but other educators within the state are looking for from this task force. So first, I just want to say thank you for your thoughtful comments and feedback and perspectives. As you notice, we only got through the first 5 of the recommendations. I do think they are the most room for discussion, although I'm not trying to take that away from the other recommendations, but I think these were really great to have amongst you all kind of on this call. What we are going to do to get your feedback on the remaining ones is send out a quick Google Docs survey where we will lay out the remaining recommendations and components and sort of ask for your feedback through that survey document, because we won't have time to meet again until our final meeting on next Monday. So we'll be sending that out today and would be looking for your feedback probably by the midday on Thursday. And then what we'll do is take all that feedback with what you shared today, consolidate it into a way that's most useful to digest, and then on our meeting next Monday, sort of run through everything and make sure that folks feel comfortable with what has come out of this task force. So that's the next steps. You can expect that Google Doc survey today, and then we would ask for your feedback on the remaining recommendations by midday Thursday. Are there any questions about next steps? Commissioner, is there anything that you would like to add?
So I would, again, just like to thank everybody for their participation. This has been really helpful for me to just listen to the conversation and the dialogue. And I appreciate the work that everyone has put into this. Great. All right, well, thank you all. We will be following up shortly. And as always, thank you, and look forward to your ongoing feedback. Take care, and we will be in touch soon.